Namaskar. I am Dr. Dixit Kr Thakur, Senior Consultant and Head, Pulmonary Critical Care and Sleep Medicine at Apollo Spectra Hospital, Chirag Enclave, New Delhi. So today I am going to talk about asthma and its management. Around 300 million people worldwide are suffering from asthma, and out of the total around 4.5 lakh deaths which are happening every year, around 40% are there in India. Asthma is a treatable disease and still people are dying of that because there is a lack of awareness between the patients and in the primary caregivers. So first let's talk about what is asthma. So asthma is a chronic disease of the lungs where there is inflammation of your airways and there is a narrowing of the airways. So to demonstrate that, so this is a normal lung pipe which is quite wide and open. When there is asthma, so you can see there is little narrowing of the airways, there is inflammation and there is little constriction of the muscles of the lungs. Now this causes the narrowing of the airways. Now patient will start having symptoms like breathlessness, chest tightness, coughing and whistling like sounds like wheezing. These are the few common symptoms. Along with that, many other symptoms also come. So now, as we have discussed what is asthma, now question is how to diagnose it. So asthma generally affects wide range of age, and any age group can be affected by the asthma, from the childs up to the elderly. To diagnose, the first point is history. Patient will come to us that I am having some shortness of breath, sometimes chest tightness is feeling, coughing with or without sputum is there, and I am not able to do my normal day-to-day activities. So once some patient comes with this, so then we try to find out the triggering agents. Triggers in asthma is another important factor which needs to be considered, because many patients are allergic to food, many patients are allergic to pollens, few having some issues with the particular fumes, many patients have issue with the smoke exposure and chemical exposure. Sometimes house dust mite, cockroaches, allergy is also there, and that can also trigger your asthma. Now to diagnose, you should visit your doctor, and first thing we will take the history. Once patient is having all of these or few of these symptoms, so then we will do a specific test. Ideal scenario, lung function test or a pulmonary function test should be done, which is a basic test in which you inhale and exhale into a device, and we measure all the parameters in the system, and then we can diagnose whether you are having an asthma or not. So PFT is the gold standard test. If on PFT we can see that there is obstruction and which is variable. So in asthma, the important factor is the symptoms are generally variable and they vary over time. Like in the morning, symptoms might be different. Some patients have more symptoms in the night and early morning. Some are having more symptoms when they are going into the office, and so variability should be proven on the PFT to label it as a asthma. But sometimes patients are already taking inhalers, so in that time the specific variability can't be there. So then we have to stop the inhalers and do the retesting to prove it. So now once we have a patient who is having symptoms of asthma, we have done the PFT and we have diagnosed it. But in some resource limiting settings in the peripheries, when there is PFT is not available, so then a basic device, a peak flow meter, can also be used to diagnose the variability and asthma. So now we have diagnosed it. What is the next step? Next step is how to treat it. So asthma treatment consists of 2 points. One is symptom control. Patient should be free from symptom. He should be able to do all his day-to-day activity, whatever he requires. And we have to prevent the risk of acute attack of asthma in the future. So both things should be catered together. So for the first part now, the Global Initiative for Asthma, this is an international society which gives guidelines every year for the asthma management. So according to that, there is a stepwise management of asthma. So step 1 to 5. Now how we go about that? So step 1 is when patients are having mild symptoms like once a week or once a month, and it is not affecting their sleep, but still their symptoms are there. Sometimes with particular season they are having the symptoms, like in winters or sometimes during the rainy seasons. So in these patients, when symptoms are mild, so then we can give them inhalers SOS. So SOS means when they will have symptoms, we will give the inhaler, and once the symptoms are not there, he won't take it. So on the next step is, like your symptoms are there like more than 4 days a week, so that is a significant amount, and now the SOS treatment won't work. Now we will give you a reliever or continuous treatment, that like inhalers having different dosage. Like if you are given twice daily, and most common is inhaled steroid with bronchodilator. So that is given generally twice a day, or depending upon what type of drug we are using, once a day also. So before going into the another steps, few points I would like to emphasize here is asthma. In asthma, the symptoms are mainly due to bronchoconstriction, means your lung pipes are little narrowed, along with inflammation inside. So inhaled steroid is the baseline therapy which should be given to treat your asthma properly. Now question arises, and many people are quite worried about the steroids, that we don't want to take it, and steroid might have side effects. But in moderate doses and in the specified doses in which we are giving in the lungs, generally the toxic effects of steroids which are coming when we are taking it orally are quite negligible, and only in very high dosage, if we are using the inhaled steroid, then only the symptoms can arise. But the risk-benefit ratio always takes us towards that inhaled steroid should be given, so that overall quality of life of an asthma patient can be made better, and he can live just like a normal adults. Even athletes are having asthma, and they are taking the treatment regularly, and even the elite athletes, just like David Beckham, he was having asthma and still he played at the international level and did so well. So if you are treating your asthma well, you can live your life quite normally. So in the step 3, now step 1 and 2, like symptoms are less, so we are giving you SOS medications. But once the step 3 comes, means your symptoms are quite there, and it is sometimes affecting your sleep also. So then we will give you little higher dosage of, or the moderate dosage of inhaled steroid with the bronchodilators. And if the symptoms are not even controlled with that, so we will further increase your dosage and add on therapies like theophylline, like nicotine receptor antagonist or the anti-allergics, and the specific immunotherapies can also be used to treat the asthma under the specialist guidance. So before going into the nitty-gritties, I would like to emphasize little bit, or to share little bit information about the inhalers. So inhalers, so basically, because the issue is with the lungs, so specifically once we will give the treatment directly through the inhalation route, we can hit the target point directly without getting much side effects. Now, what are the various drugs which can be used in inhalers? So basically 3 forms of drugs are available, like the 3 mechanisms which we use. One is inhaled steroid to reduce the inflammation. Different types of inhaled steroids are there, like budesonide, then the cyclosonide, and few others. Along with that, the beta-2 agonist. Beta-2 agonist is another bronchodilator which relaxes the muscles of the airways, and these are also coming in different forms. Few are acting for the short time, like the common drug which we are using is levosalbutamol as a SOS drug, or the acetylene inhaler in the common terms, and another inhalers like formoterol. These are beta 2 agonist drugs which can be used twice daily, and they are longer acting beta 2 agonist, and they relaxes the airway muscles and make it little normal, and the bronchoconstriction or the lung pipes narrowing which is there, it improves and patient feels better. Third drugs are then the antimuscarinics. Antimuscarinics are the another group of drugs which also relaxes the bronchial smooth muscles and make your airways wider and your symptoms improves. So these are the three main inhaled drugs. They have different forms. Few are shorter acting, few are longer acting, few are ultra longer acting, and under the supervision of your doctor you can take that. Now comes the next part, that we have decided you have to take inhaler. Now what type of inhaler, because many medications are coming in different forms and all having the same mechanism. So the choice of the device, it depends upon the patient preference, what drug the doctor want to use, along with that the affordability issues and sometimes coordination issues, like in extremes of ages, if patient is not able to have the proper hand-eye coordination, so then we can't use the normal inhalers, like they have to coordinate with the pressing of the inhaler and then use it. Although I'll be demonstrating all those things in the further part of my lecture. So depending upon the patient preferences and patient's choices and what drug we are going to use, so we will decide the devices. Now I'll just show you few devices which are available and which are generally being given. So this is one of the most common device which we are using. This is a metered dose inhaler. So basically the inhaler is there, we have a fixed dose, and once you will press it, you will shake it and we will press it, so you can see there is a dose coming out, and that's how there is a fixed metered dose which is coming out. Another important point I would like to emphasize here is the most of the time the asthma patients, if they are not having the well controlled symptoms, the major issue is with their technique. So every time a patient comes to us, we always check for the technique, and if your technique is not proper, so then the drug is not going properly inside your lungs and you are not getting the proper benefits. So just to demonstrate a metered dose inhaler, first you have to see how to use it. So I'll just demonstrate. First you have to shake it, then open the cap. You have to exhale out first and empty your lungs. Then you have to keep it in the mouth. You have to press it, and once you press it, so then you will take a deep inhalation. And now you will hold your breath for 5 to 10 seconds so that the drug is getting absorbed inside the lungs, and after that you can exhale. And that's how the ideal technique of using a metered dose inhaler is. Now if somebody is having the problem with the coordination, so then we give them sometimes the spacer. The spacer is nothing, a hollow chamber which we connect inside along with this device, and you will press it, the medicine goes into the chamber, and then you can normally inhale. In that you don't have to coordinate. So this chamber or the spacer is generally given for the extremes of ages once patients are not able to coordinate with it. Another type of device is rotahilar, or this is called a rotahilar. In rotahilar, it is the medicine is in the form of a capsule or dry powder. So the demonstration for the rotahilar is there is a dry powder inhaler. So this one is a metered dose inhaler in which the medicine comes out as a mist. So now in dry powder inhalers, the medicine you can see in the chamber, it is in the form of a powder, and this powder we have to inhale. So dry powder inhaler devices are of different type. I am just showing you few of them, and once you will insert your capsule inside that, you will rotate it, and now you can see the capsule has been broken. So the technique for this is also same, but there is no as such coordination needed to take the medicine. So same process. Now you will exhale first, keep it in the mouth and take a deep inhalation and hold. And hold. You can see the chamber is empty. I have taken out the whole of the medicine inside, and medicine goes in. So now after that you will just remove this capsule and you are done with this device. So these dry powder inhaler forms are of different types. Various machines are coming now. Another machine is like this. This is just a cap. You will rotate it. There is a empty chamber inside where we can place the capsule. Now you can place one capsule inside whatever medication your doctor has given, and then you can press it. Now pressing, the two needles are coming out and the medicine is coming out. Now the medicine is there in this ruptured capsule. Just like this rotahaler, this octahaler can also be used. So multiple devices forms which having the same mechanism. You just have to insert a capsule inside and then you can use it. Another form of devices which are available are autohalers. Now these are a form of meter dose inhalers, but in these autohalers, these senses your breaths. So the issue with the coordination of meter dose inhaler which we were facing, now that issue is already taken care of by this device. So you will shake it, you open it, and you don't have to press it now, because in meter dose inhaler you have to press it, you have to have a coordination, but now in this device there is no coordination of device. Along with that, there are few rotahalers, and these are also dry powder inhaler where you have to rotate, and so different devices which are having little bit of different mechanism, but basics of all these is same. So this is the type of few devices which I shared, and through which we can give the bronchodilators or the medicines which should be delivered into the lungs. Now these are the medications which can be used in the ambulatory patient. You are going anywhere, you can carry it. Sometimes in severe cases, once asthma attack is there, so then we have to use the nebulizers. So now the question arises, many of you, if you are asthmatic, you have seen that, but just to brief you about the various type of nebulizers. So nebulizers are generally of three types. Generally all the nebulizers which we usually see are generally jet nebulizers. So this is a form of jet nebulizer. You also must have this device at your home if you are using, or if you have ever visited for your asthma attack. So you will just connect a nebulizer mask with it. Now there is a chamber, and this chamber works on the Bernoulli theorem. Like the nozzle is very narrow, a fast gush of air comes in, and we will insert the respule or the ampule of medicine through here, and now once we will turn it on, so this gush the medicine will be lying in this chamber, and this gush of fumes will come and you can inhale. Now this is one form of nebulizer. The important point or the logic of showing this machine is to avoid smoking, either directly smoking or the second-hand smoke. Second-hand smoke means if somebody else is smoking in the same room, so you are also getting the smoke. And in the current times when the pollution level is so high, so this pollution is also triggering your asthma, and many of the asthmatics are coming to the OPDs these days and coming with the increased symptoms, because now pollution exposure is triggering their asthma and they are not being controlled on the medications which they were continuously taking. So that is second. One more point I would like to emphasize here is a very important device which every asthmatic should have is a peak flow meter. So this is a peak flow meter. Peak flow meter is nothing, you just have to inhale deeply and exhale completely. Now once you will exhale, so this meter will go down and there will be a fixed value. So once your asthma is fully controlled, there will be a base value for you. So once that base value comes, so I'll just demonstrate how to use it. Just completely inhale. So my value comes around 630. So you can see, I think on the other side, around 630 is my base value. So in asthma, if your asthma is well controlled, you will know that this is my base value. Every asthmatic should do it at least once or twice daily. Base values should be kept in mind, and once you will see that values from the base value are going low, it means your asthma attack is about to come and you have to escalate your treatment, or you have to visit your doctor so that frank attack of asthma doesn't come and you can prevent it earlier. So peak flow meter every day you should be keeping, and you should be checking your values every day. Now, what are the warning signs or signs which will warrant you to contact your healthcare provider immediately? So if you are having severe breathlessness and you are not able to talk also despite taking the inhalers or the extra inhaler dosage, it means there is time to visit your doctors. If you start feeling drowsy along with that, and if your oxygen values, in an asthmatic the oxygen values are generally not affected, and if your oxygen values falls below 93, so it means there is a serious attack and you have to rush to your healthcare provider and take the necessary treatment so that you can get it well controlled. So at the end, to summarize, first, asthma is a treatable disease. Take your medications regularly and you will feel fine. Inhaled steroid is the baseline of the asthma treatment, and that should always be there when you are having asthma. Along with that, add-on medications like bronchodilators, either beta-2 agonist or antimuscarinic agents, they should be used. Along with that, in serious cases or in the severe cases when symptoms are not even controlled on the high doses of these inhalers, then we might have to use anti-allergics or add-on therapies just like theophylline, or sometimes in very severe cases immunotherapies. Inhaler technique is very important, which needs to be emphasized with every visit when you visit your doctor, and you should also keep a check whether you are taking it properly or not. Another important point which I would like to emphasize, after taking these inhalers, if it is containing steroids, just like in asthma everybody will be having inhalers which are having steroids, so then you have to rinse your mouth after every time you take your inhaler. So this is another important point which many patients miss, and they might land up with the oral infection because this steroid medicine getting deposited in your tongue and in the oral cavity, so that is a high risk for the oral infection. So every time you take your inhaler, do your mouth rinsing and you will do fine. Regular follow-up with your doctor is a must. Ideal scenario, this PFT, the lung function test, the 2-3 important points for lung function test, this is used to diagnose asthma. So first time you came with the symptoms, so your doctor will do it and you will diagnose the asthma. Second is for the regular follow-up, whether your values are okay or they are also still at the lower level, so that whether we can decide your medicines are going fine or we have to modify your medications. That will another guidance which comes from the PFT. And ideal scenario mein, we have to do PFT at least once or twice a year in the adults. Don't stop your medications without talking to your doctor, because in the initial phases you won't feel symptoms are much, but ultimately inside the lung inflammation is going on, your asthma can become brittle, means now it will become irreversible, and then in that case even the medications won't show that much effect and you might have to use higher dosage. And then if oral steroids, which are the last resort sometimes, which we use in the acute attacks, that also needs to be used, and that also comes with the side effects which needs to be looked after. Along with that, one more important point I would like to emphasize here is vaccination. So asthma triggers can be a viral infection, can be a bacterial infection also. So vaccination against influenza and pneumococcal and COVID, they should be taken, and because if you are taking it regularly, all the vaccinations are complete, the chances of getting these infections will be less, and chances of getting acute asthma attacks will also be less, and you can live a healthy life and you can do all your activities without any restrictions. So with that, I'll come to the end of my talk, and if you need any consultations from me, so I'll be available at Apollo Spectra Hospital, Chirag Enclave, New Delhi, between 10 to 3 every day between Monday to Saturday. Thank you very much.